Not good. Not good. That was the assessment today from Governor Jim Justice as he detailed the latest COVID-19 numbers. The biggest concern, the rapid growth of a dangerous variant.
New positive cases.
The governor says he does not want to alarm people, nor should the public panic, but the state's COVID-19 numbers are getting worse. In the past day, there were 255 new cases. West Virginia now has more than 1,900 active cases. That's more than double the count on July 9th. And the Delta variant cases are now at 100. That's a 125% increase since Tuesday. And the Delta variant is far more contagious and lethal.
The Delta variant can be present in such high concentrations that people can get sick and can transmit potentially the disease who are fully vaccinated.
In fact, of the 100 Delta variant cases in West Virginia, 34 of the people were fully vaccinated. To combat the situation, the governor is asking people to voluntarily participate in a study. Those over age 60, including people in hospitals and nursing homes who were vaccinated more than 6 months ago, will be retested.
We're finding that the antibodies that you have to fight off a Delta variant have diminished, and you may very well need to be looking at a booster shot.
Governor Justice says he is not inclined to bring back a mask mandate despite the spike in some key indicators. But health officials say it might be a good idea to keep a mask with you at all times and wear one where you feel uncomfortable, perhaps in a crowd. The governor is also ordering that nursing homes and hospitals check their supplies of protective face masks and sanitizers to make sure they have enough. They should also evaluate staffing levels as COVID numbers continue to spike.
And because of the severity of the COVID-19 increase, Governor Justice will go back to holding 3 media briefings per week on Monday, Wednesday, and Friday. That's beginning next week.